Neither the El Paso Medical Society, its members, nor PBS El Paso shall be responsible for the views, opinions, or facts expressed by the panelists on this television program. Please consult your doctor.
Although we know a lot more about COVID-19, there are still many things that we're learning every single day. We are here this evening to discuss the emergence of more perilous and also transmissible variants of COVID-19. The medical community would like very much to urge every person age 12 and over to get vaccinated. We're not here to tell you what to do. That's not what this is about. I know people are tired of that. However, we are here to stress that it is an increased risk of severe disease and hospitalization for everyone who remains unvaccinated. There are questions, there are a lot of them, and that's why we're here this evening. It's a great time to call in and ask. This is a live program, so call with your questions. The number is 881-0013. This evening's program is underwritten by the American Heart Association. We also want to thank the Texas Tech Paulo Foster School of Medicine for providing the medical students to man our phones. Today we have Madeline Morris with us, and so when you call in, Madeline, look up, you're on camera. Hi. Madeline's going to be answering the phones, and again, she's a medical student, so she kind of knows how to give the jargon our way, and we will get those answered for you to the best of our ability. And again, there's a lot to be said. We have also the El Paso County Medical Society, who has been providing the show to you for many, many years. I'm Catherine Berg, and you are watching the El Paso Physician. We are talking about variants of the COVID-19 and also the vaccination, sorry, it's easy for me to say, vaccinations that we are looking at in America, in Texas, in El Paso, and then also around the world, what's happening there. But the important thing is that we are trying to urge people to get the vaccinations. And we're going to talk specifically this evening about 12 years and over, specifically 12 to 17. And with me, we have Dr. Glenn Fennelly, who will probably recognize him. He was here not too long ago, just a couple of months ago. He is the chair of pediatrics at Texas Tech University Health Sciences Center, specializes in infectious disease and specializes in making vaccines, which is kind of cool. He came to us he's from New Jersey, came to us from New York. And he has been here for not too long, but you have really making an impact here. And then we also have Dr. Hassan Saloom. I'm smiling. So before I tell you what he does for a living, let me just show you what he brings. He comes in and he brings us cookies. He has this bag, and I'm like, what do you have in the bag? Props? No, I got cookies. I said, yeah, right. And hold on, and we have baklava that's somewhere else. And I just think the world of you, and so I want to eat these, but then I'll be spitting on everyone. But Dr. Saloom comes from us originally from Syria, and then he was in France, and he was just going to come for a little while, and he just never left. And thank God for that, because I'm gonna enjoy some of your food later on. But he is a pediatrician with West Wind Pediatric Clinic Specialty, also the president of the El Paso Pediatric Society, and chief of pediatrics at Las Palmas. So we definitely have some experts here this evening. And I want to just jump out of the gate. Dr. Fennelly, I know you've been here a little bit over a year, but talk to us about your background. And I think that's so important, because I know we didn't get into that till almost halfway through the show last time, and it really made sense. So your work with vaccines and what we're looking at right now, just kind of give everybody in the audience what you do and what you've been doing for the last several decades.
So briefly, when I was at the end of my general pediatric training in New York City, that was during the time of an outbreak of measles back in 1989 to 1990. There were about 30,000 cases nationwide in the U.S., and we saw dozens of cases in young infants that were too young to be hospitalized, even though we have a vaccine to give to kids 1 and above. So for me, it taught me very rapidly that if there's measles anywhere, everybody everywhere is at risk, and we needed to do better in terms of perhaps immunizing across the lifespan. So that's what got me thinking about better vaccines, better ways to get it into kids earlier in life, and how to do it in a safe and effective way.
And that's so important too, and bottom line, we got to get it out there. Dr. Saloom, so let's talk about you. You are a pediatric guy, What do you do all day, every day? And you were talking about you speak 4 languages,
Yes,
so that's
ma'am.
kind of nice.
I speak-
Do you also bake 4 different things,
Actually,
at
this
least?
food being baked by Dr. Ma Salom is my wife.
Ah,
She and was hoping to come with me. She cannot make it, but in the future she will be happy to make it.
well, thank God for that.
Yeah,
I'm
thank
looking
you.
forward to that.
And she's looking forward to my Dr. Fennelly as well.
Nice.
Yeah.
So all day, every day, what do you get to do? Again, it's pediatrics,
yeah.
but especially in this day
You're
and
right.
age.
We are a clinician.
Okay.
We have 2 practices. We are busy practices. We see roughly average 100 patients a day.
100 patients
Yes,
a day.
ma'am. Between the two
100
offices.
patients a day.
Yes, ma'am. Between 2 offices, we are 6 providers. Though.
Okay. Okay.
We have 3 physicians. We have 3 4 nurse practitioners as well.
Okay.
COVID affected us before. Last year, in May and June, we were scared of patient coming to us. And the patient coming for physical was scared of us. For that, our business was to the nadir. And we used to close at 12 o'clock. And we go home.
Oh, wow.
And with uncertainty, fear, anxiety, all these factors affect business. However, right now, I heard that we arrived to the threshold of El Paso, 70% is vaccinated. And they say, Dr. Lee knows about this, you don't need mask anymore. Right now, we're seeing roughly 100 patients a day.
Okay.
And between this 100 patients, we emphasize in preventive medicine and we encourage vaccine.
Okay. And I'm gonna talk to Dr. Fennelly, and I were talking right before the show too. I'd like to state some numbers if we could. To the best of your ability, I know they're changing constantly, but we have vaccination rates nationwide, certain rates in Texas and certain rates in El Paso, and we're doing pretty darn good. So to the best of your ability, where are we right now?
Yes, I think we have a lot to celebrate locally. I think we did very well early on in the pandemic in terms of adherence with mask wearing. Believe it or not, El Paso was among the top in the country in terms of those rates. More recently, we broke the 70% first dose immunization. We're one of only 7 of the what be considered a major city in the U.S. There are 300 with populations over 100,000. So we're one of only 7. We're at 72% nationwide. We're maybe barely breaking 60% with first dose immunization. Statewide, we're only at about 50% full immunization. So we're doing very, very well. Where we need to do better is right now the vaccine's approved down to age 12. Statewide, we're only at about 26% first dose immunization. Again, it's relatively new for that age group, but we need to do and could do much better there.
And I agree, and I'm going to talk to Dr. Saloom in a minute about that. What I would love to ask you, and also brag about El Paso a little bit, why do you think, you and your colleagues, I'm sure have kind of talked about this, how is it that we have done so well? I've had different, shows going on, and the way that we just put things into place before the vaccine was even here. I did a show back in October, and they're already readying themselves of how we're going to distribute that. But let's talk about that process of how El Paso put it together.
Very good. So when I first arrived in El Paso on August 1st of last year, for me it was a pipe dream that the vaccine would even be available or approved, shown to be effective by late calendar year. The fact that we had it available before the new year was remarkable, and what was even more remarkable was the way that the community banded together. The public hospital, UMC, Texas Tech, the hospitals of Providence, everybody banded together, major vaccine drives, and it was remarkable to see the long lines of people lined up. I was so grateful when I was able to complete my series by early January, and to see all of my colleagues get it, our staff, there was enough vaccine available that we could prioritize, get all the hospital workers, first-line responders. We brought in dental technicians. We brought in FBI agents. There were no plans for these agents. So it was really a remarkable thing to see. So I think, again, it was that community participation. There was no charge for this. People volunteered to give the vaccine. So that, I think, is something that is perhaps unique to El Paso, and it's got us to where we are now.
See, and this is why you can't leave us. Because we're cool here, it's
cool.
just the way we roll. It's the way we roll. So let's talk about pediatrics. So we're looking at this great percentage of adults 18 and over, and now we really are concentrating on those that are 12 and 17. What have been, and I'll ask in a little bit too what all the controversy is and questions, but what right now do you feel is holding back the age group from 12 to 17 to get their vaccinations?
I think in general there is hesitancy about vaccine in general before the COVID vaccine. Some people attribute autism to vaccine, which as physician we know this is not true. Some people think this vaccine is so new and the disease is new. Some people thought if you get the vaccine, you change.
Right.
Maybe you become a monkey, you become a dog, God knows what you become. And some people say they are going to put chip in your body. It means this misinformation makes the people a little bit anxious, number one. Number two, the side effect and this reputation about some clotting as like AstraZeneca vaccine, some inefficacy as like J&J vaccine, and this new mRNA vaccine, which is a new technology, and people in general, they have fear of new stuff.
Yeah, fear of the unknown.
You're right.
As they
For
would say.
like, I think fear of unknown, and we're doing as community our best as pediatrician to educate people. We spend a lot of time that we are vaccinated, our children vaccinated. We are not, I haven't changed, I haven't been a monkey, I don't have a tail, I look normal, except my accent.
Except your accent, yeah.
Everything
And if
goes
you've got
good.
several languages in there, that's
you're
good.
Right.
That's
And we're
good.
trying our best to educate.
Okay.
And I want to see what Dr.
Yeah, I honestly wanted to ask you the exact same questions. And again, it's been kind of proven that fertility, I hate to bring it up, but everybody talks about fertility. So I would like for you as a medical individual that's here, both of you, talk about that and then talk about all the other things that the myths are sort of around.
Sure.
I almost felt like, I would love to have the 20 myths about the vaccine and then just bust them all.
Right.
So this is that time to do.
So the headline about the vaccines that have been approved and fertility is there is zero evidence that any of these vaccines can cause fertility. Mechanistically, it's just not plausible. Early studies were done in animal models, so-called DART studies that address risk during pregnancy, developmental and reproductive toxicity, animal model-based studies. There's zero evidence that it impacts a pregnancy. In the phase 3 trials, there was one loss of a pregnancy, but it happened out of about 24 women that were inadvertently immunized during that trial, but it happened to be in the placebo group. Post-marketing, there is zero evidence it's impacting pregnancy. ACOG, the official body that sort of is the expert or thought leaders on women's health and reproductive health, the guideline here is that every woman should go through the process of being informed about the benefit and the side effects.
Right.
But there is no barrier to immunization, and that's not a requirement. So whereas it is not officially approved as of yet because the full data isn't there, there's no barrier, and the risk of not being vaccinated during pregnancy exposes you to very high above the usual risk for severe COVID.
So how are, this is a hard question. So how, when you're talking about the process of being informed, that in and of itself is such a big thing because information now comes in all sorts of ways. It's coming in through social media, it's coming in through whatever your feeds are getting. You've got 20 news channels on any given day. How would you suggest, and this is for both of you, how would you suggest that people get the proper information versus just what they're hearing from the atmosphere here and there? And I'll start with you. Where should people look?
Number one, we have to trust the organizations like the FDA, Food and Drug Administration, the CDC, the advisory committees to the CDC on immunization practices. They look at the evidence, they look at the post-emergency use authorization approval data on side effects, and they're in the process of figuring out what is plausible, what can be linked to the vaccine, and what cannot. First and foremost, we have to trust in those bodies, and we have to trust in that data. Tomorrow will be a very important date in that regard, in that an advisory committee to the CDC will be looking at some of the evidence around myocarditis in children and young adults that have been immunized.
About that last time. Okay.
And it's plausible, yes. It looks like it may happen within 4 days of the second dose. Is it a causal? We don't know yet. We hope to have more information after this meeting, after all of the evidence is looked at. So we have to begin with the evidence. We also have to, I think, the medical community, we have to be clear where we get our information, and we have to be careful what we say and repeat. We have to stick with the evidence. And I think families need to feel comfortable coming to us for guidance. Don't get guidance from your aunt. Don't get it from certain news outlets that are taking partial evidence and saying there's a risk, again, in the balance, the risk of still being exposed to COVID and getting severely ill are an order of magnitude higher than any hypothetical or theoretical risk of vaccination.
And there's a phenomenon, and I don't know if we spoke about it specifically on this program or other programs, but there are certain communities, and ours is one, that, you know, the person that lives down the block is the one that knows everything, and then that's, you know, in the thought process that they know everything. But again, if you're looking at websites, one of the quickest things that I say, instead of looking at a .com, look for something that says .org. That usually means that it's an organization that either is a nonprofit, they're not out to sell something to you, it really is more of an information. I do a lot of WebMD information, and if there's places that you want to throw out there, by all means let me know. But same question to you, Dr. Saloom. When we're looking at how to get information out to people, what are you telling your patients? What are you saying to your parents? Your parents, meaning the parents of the patients that are coming in. When you're looking at 100 patients a day, what are some of the questions parents are asking you about the vaccine?
Let me tell you real stories. Number one, I agree with Dr. Fennelly. However, I prioritize, I make a priority. I think number one is our primary care physician. This was
a primary care physician.
This was the people trust the most. For example, in our case, we have this baby since the baby was 1 day old until 18 or 21. And number two, the mom, she will tell you, I look in Google, I watch the TV, but I come back to you. It means, I think number one is PCP, number two then CDC and FDA, and this very reputable, has reputation source.
So the number one person to go to is whoever your doctor is now. Ask that question. You've already gotten an established relationship with them. They know who you are. They know your body. So that would be the number one place to go. And then again.
And the other story, for example, today I have 2 cases, and yesterday I have 1 case. Yesterday I have 16-year-old boy come to me for physical. He has some concern about his private area, and the mom jumped to me. I'm not going to give him COVID vaccine because he got fertility. I spent time with her.
Where did that come from?
I don't know.
Right.
Today I have another case. A mom, she's a teacher. She's very informed lady. She's smart lady. She read a lot. She told me, you know, look, my daughter right now is 12. She's going to have her period next year. I'm not going to give her the vaccine. I say, why? She says, because I heard the vaccine disturbs the period, makes the period very strong, very light, irregular period, and I educate her, and she listened to me, and I convince her.
So she has the vaccine.
She will.
So you did good.
She will.
Okay.
Another child come to me, as like Dr. Glenn knows, some people has anxiety, adolescent, and when you have anxiety, you have chest pain, and you have your heart goes fast. And 2 last week, they come to me, the parent, say, look, Dr. Saloom, do we give the vaccine to X and Z? I say, of course. She says, but you know, the heart rate is fast. And did you hear about myocarditis and pericarditis and this study in Oregon and this study in Israel? I spent time with them, and I was successful on all these cases. I convinced them, and they will get the vaccine.
Right. Well, that's good. And actually, I'm going to hop in really quick, and I'll say this a couple of times throughout the program. If you are interested in having your child, age 12 to 17, get the vaccine, and we hope that you are. And again, we're here to disband these myths that are out there. And I want to talk a little bit, because I've heard about fertility too, but I've not seen anything that's fact-based on it. So I'd love to see where and how that came in the first place. I don't even know if that's something that we can answer. But vaccinations are open and free, drive-through at, was it the Civic Center? Sorry, that's the one thing I didn't write when we were looking that down. So it's at the Civic Center.
That's correct.
We're looking at the Civic Center, and it's 8 a.m. to 7 p.m. Monday through Friday. So 12-year-olds to 17-year-olds, there needs to be a parent and or a guardian with them. So 8 a.m. to 7 p.m. at the Civic Center Monday through Friday, or 8 a.m. to 4 p.m. on Saturdays. So that's super duper important. Also, we were talking about Walgreens. You can make an appointment there. Sometimes you can walk in. I was at a Walgreens today for something completely different. I was getting a passport photo, but there was nobody there. So if that's the case, give that a shot. CVS, give that a shot. If you have primary doctors, you can have that. Pediatricians, you said not all of them have them, but they're starting to get in. Is that correct?
That's correct.
Okay. And how is that? How is that rollout now with private practices? Because I know for a while that was taking a while and it was being done. So do doctors order a certain amount of vaccines? Is that how that's being done?
That's correct.
Okay, so tell me that process.
We applied 1 year ago
Okay,
to be a provider.
okay,
And then the criteria, thankfully, it's been changed. Initially, the ones, for example, this Pfizer vaccine has to be stored in minus 70.
right.
Right now, they say you can keep it in the normal fridge for almost 4 weeks. And the problem, only the logistic problem, when we add the vaccine to the dilution, you have to do it within maybe 4 hours. This is the reason we prepare the patient, we have the list of the patient ready, and we call them as a group,
Okay.
and we give the vaccine. We don't want to miss any doses.
Absolutely, absolutely.
Some physician, they say you have to order again, and you need a password and username to get the coming to you the shipment.
Okay,
For that, some people already have it, some people doesn't have it.
okay,
But the primary care right now, they are very comfortable to give the vaccine. Only we need the patient when they promise to show up. Some people they say we have only one call with husbands. Other people, I lost my phone, I did not hear. This is a real problem. We have to address it with the patient before we open
right.
the vaccine
Before you-
and dilute
So
it.
how many, and this is just a curiosity for me, so how many come in a package? I know you get a box, but if you have a package of 10 vaccines, to unfreeze a certain amount at any given time, is it like 10 at a time? 'Cause I remember when I got my vaccines.
Right, it's 5
felt
to
like they
6
were-
per vial.
Okay.
But I mean, the shipments are over 1,000, 1,100.
Right, right.
Currently.
But you can keep frozen like 10
Yes.
vials at a time and then bring out those 10 vials at a time.
But the
which
vial
then-
give you 6 doses,
Okay,
each vial.
okay. Nicely said. So we talked about some of the concerns, but I do want to just ask, because I want to so specifically, and I'm about to have a coughing fit, I can tell, talk about where this myth of infertility comes from. Because that's the first thing I heard. My daughter asked about that. She's 24. I'd like to just throw out to the audience why that's out there and why, and you may not know. I mean, it may be just something that's just thrown out there, but again, I'd like to stress that over and over again because that's the number one question I keep hearing.
I can't comment on where it comes from. I can only comment that in the many decades I've been in pediatrics and some of my global health work, this was a reason back in the former Yugoslavia that children were getting polio. There were concerns in the breakup of that nation into in particular the Kosovo area. Families there were propagating this claim that children would be fertilized if they got the polio vaccine. As a result of that, there was a polio outbreak. There hadn't been polio outbreak there for decades. So,
Right.
it took international organizations to come in, reassure. So this has been there forever. It also has existed around polio vaccine in other nations. So it's sort of a trope in certain ways. And I think there are many groups out there that do promote these theories. There, again, is zero evidence. We have to stick with the facts. And there are other stories I've heard, like it will impact or delay menstruation, even if you're exposed to somebody who's been vaccinated.
Oh, gosh.
And this borders on an absurdity. Again, sticking with the facts, all of the approved vaccines, these are not transmissible agents. It's either a piece of RNA or it's actually a virus that can't replicate to make copies of itself. So that's an impossibility. So it's difficult to counter it. I don't know where they come from, but again, we have to counter that fiction with the fact. And again, I appreciate your point, and it's remarkable to hear how you're able to persuade these families. In our own practice, we've heard the same stories. Males, 12, 13, the parents want them vaccinated. The boys say, I don't want to because I'm afraid I won't be
A
fertile.
father, all right, right. And again, I'm glad that we continue to bring this up. I've got a question here from the audience, and this is something I have not heard often about, but I'm thinking about little ones once we get to the point where we're under the age of 12. But a question is from the audience, is there an oral dose of the COVID vaccine being developed? And I don't know if that's something that is right now. I'm just thinking about injections. That's all I've heard about, and maybe Dr. Fennelly might know.
There are certain companies that have taken the adenoviral vector approach and are looking at intranasal, some promising early data. I don't think it's gotten to the point of pediatric trials. Again, most vaccines overwhelmingly, with the exception of oral polio vaccine, oral rotavirus vaccine, are given intramuscularly. It's a safe, reliable way of doing it. For the most part, you're going to have a bit of discomfort. With the COVID vaccines, that's a bit more accentuated, that pain. But again, it's absolutely safe. We know the dose is getting in there. It would be beautiful in time if we can do that, but it's going to be much longer in terms of new route, new formulation. These vaccines we're talking about down to 6 months of life, Pfizer, Moderna, that data is going to be available soon, and we may have approval before the end of the calendar year down to 6 months of age.
So I hate to capitalize your time, but you were talking the last time you were here too. With FDA original approval, I know this is emergency use approval, I get it. When there is a vaccine that's introduced to the FDA, on average, not COVID related, on average, how long does that take for FDA approval? What process does that go through? And the reason I'm talking about that is that with emergency use approval, which we really needed, I'd like to combine the two and explain that to the audience.
Okay, very briefly, so what is EUA, or emergency use authorization? It was really, this mechanism was established in the wake of 9/11, the terrorist attacks, and it was meant as a way to rapidly approve biologicals, vaccines, treatments against potential bioterrorist agents, for which none existed. Some were under development. What has to happen, there's sort of 3 or 4 steps. First of all, there has to be identification of a threat or a public health threat. We were there pretty fast with COVID.
Yes.
The Secretary of the Health and Human Services has to recognize this. They declare an emergency. That gives the FDA the authority to use this mechanism. What's necessary, you have to do studies. You have to do large phase 3 studies that show efficacy and safety. Based on that data, you have to say this is likely to work, it's probable it's work, based on very rich, clear, and compelling data. You also need to demonstrate that it's probable, highly probable, that it's safe within the context of that study. You need at least 2 to 3 month follow-up, and then after you approve it, the prediction is it's going to continue to be safe. The other criteria is there's no other alternative. Here, the only alternatives we had were hand washing, face masking, our medical practices being down to 0, us not being able to see friends and family. So again, this is remarkable where we are.
Right.
Otherwise, the process can take years. However, given how quickly things have moved, the incredible response in terms of volunteers for studies,
Right.
the numbers or the sort of power of these studies, we probably will get to full approval for maybe Moderna, Pfizer, relatively soon.
Okay. And full approval, is there any country in the world right now, and I don't know the answer to this, but is there any country in the world that is not looking at going forward before full approval? And I know that for a little while in Europe, and it wasn't Johnson & Johnson, it was...
AstraZeneca.
Thank you, AstraZeneca. So that was the one too, and then that was clear too. So my point too is, even though it's emergency use vaccinations that are approved, there were still studies involved prior to the approval. And I think that's so important to let people know, because yes, it happened fast,
Yes.
but there were studies, and it has been shown, and that's so
Absolutely.
important.
And it's important also to look at what was the bar that was set. The threshold that was set for effectiveness was 50% effectiveness. And here we were at more than 90%, 95%, which is remarkable. On the adverse events side, it wasn't much more than, it was sort of, if you will, an amplified version of what would be anticipated from a measles shot or a DPT shot. Pain, swelling, a little bit more severe, but it went away and it was self-limited. There have been concerns that have come up, and this is part of the reporting that happens with any vaccine, the vaccine adverse event reporting system. There's a lot of data coming at the FDA that's collecting that. That is being used and manipulated to a degree. We need to know what's the denominator, what's the population from which that's being reported, and then looking backwards and saying, is it plausible that there's causality with any of these? We know, on the other hand, that we would be at 1 million plus deaths perhaps from COVID in the US. We would still have our wards filled. We'd have 150, 200, 250 patients at University Hospital alone if we didn't have the vaccine.
Exactly.
So,
I want to talk about boosters, and I don't want to end the show without doing that. And I don't know exactly where to fit that in. But there, and I'm going to talk specifically about kids for a second because there was some confusion. I'm just going to read this because it's easier for me to do it like this. Confusion arose from a false report service on social media saying that the spike protein on this coronavirus was the same as another spike protein called the Syntin-1 that is involved with the growth of the attachment of the placenta during pregnancy, this and that and the other. I know that you're specializing in pediatrics. You were talking about treating children a year, a day old, etc. So I want to talk about this because, again, that was a social media report, talk about pregnancy, talk about newborns. How is it as a pediatrician that you were talking to parents, you're trying to educate and trying to let them know that these vaccines still are important, but then there are these reports that come out that, again, are unfounded and they're on social media. How do you deal with that with your patients?
Social media, unfortunately, can I say something about myths before I continue?
Absolutely,
Okay.
yes.
Myths, unfortunately, glue
Yes,
forever.
right. Yes,
And
that's
yes,
true, right?
yes. For example, right now,
You go outside with your hair wet, you're going to catch a cold.
Yeah.
Yeah.
You see right now, exactly. That's
Right.
what I'm going to say. Everybody, why he's sick? Because he catch a cold, he was walking barefoot.
Yeah, right.
I was invited in 2019 to international meeting in Syria. I was a keynote speaker there. And then after we sit down there, we talk. A lady, she came to me with a child, 5-year-old, has wart, and another lady came with another child, has molluscum. Wart and molluscum is very common. You know the wart, common rash.
Just
Yeah,
a wart
the
on your
wart,
skin,
yeah,
a wart.
yeah.
Okay,
And
okay,
molluscum is a little bit similar to wart, but it's softer a little bit than a wart.
okay.
Wart
But also a skin
is
condition?
skin condition, it's very
Okay,
common.
okay.
And wart is more rough than molluscum. Molluscum is a little bit more smooth and not
Okay.
rough. Then I told her, there's 2 different rash and this is a virus. And the grandma said, no. He was counting the star in the night.
Oh, goodness.
And
that's how you
happened
got-
to me accidentally, 3 months ago, a lady Mexican lady came to me with a grandma with molluscum. I told her, this is a virus, it's common, it comes from the dirt, swimming pool. And he said, no, doctor, he was counting the star. And until now, we cannot get rid
Well,
of.
they last for generations,
Yeah,
and that's what Dr.
right.
Fennelly was saying.
Right.
A lot of these questions are
Yeah,
from
until
old
now,
vaccines. Yeah.
The most important part of hesitancy toward vaccine, autism. We cannot get rid of this myth that
Right.
it doesn't give you autism. This is a problem. Let me talk back about the spike. When the vaccine came, it was some improvement in G5 towers in the world.
Oh, for cell towers.
You're right.
G5 cell towers.
You're right. And
5G
they say
cell
right
towers.
now,
Okay.
this is a conspiracy, and you will have a chip, and the GF tower is going to watch you, and then Bill Gates call you from Washington, move your hand, blink to me, move your, and this
like a Metropolis
combined
movie.
together.
Yeah.
Unfortunately, this spike protein in the uterus to make the placenta has nothing to do with the spike protein of the virus, which makes the disease.
Gotcha.
And the people attach it other than a myth. Actually, it was, we know that a lot of women has the COVID infection. The baby come great, no problem.
So we know at least, and I've heard a couple of reports on this, so we know at least if there was a pregnant woman who has COVID, even if she still has COVID while giving birth,
That's correct.
the baby does not have COVID.
The majority, they don't have, the
Okay.
majority.
Okay.
And we see every day, maybe every day I see minimum or average 5 babies every day. And when the COVID was spiking in El Paso, was at a peak time, every day I have 3 or 4 COVID positive baby. All of them do great, no problem, feeding well, thriving well, breathing well, no rash, no problem. They're doing very well. Actually, I was reading the other day about this spike protein. They say the uterus, specifically the uterus, doesn't have the AC2 receptor.
Oh, the
This
receptor.
is the one they were talking about.
Okay.
The
Inhibitors
spike
and
protein
receptors,
to the, yes, and doesn't have it. For that, most likely uterus and placenta are sensitive for the virus. That's the reason we don't see a baby with congenital
Right.
COVID. Maybe the virus come to the baby after being born,
Right.
from the hand, from the nose, from the environment.
Just another beautiful way biology works,
yes.
right? The protection of someone who's pregnant.
For that, this another myth and attached to the people, and they talk about it. This 5G or G5 come together with the vaccine. They attach to the anything in spike right now. They are worried it will be coronavirus.
Interesting.
Yeah, and this
Right.
no truth about it because maybe only 3 babies got sick with COVID, the vaccine, but they did very well. In my practice, when it was a peak, we had 82 patients.
82 children.
Children
Okay.
has COVID positive
Okay.
from parent or from environment. Only 2 get sick.
Okay. Getting sick meaning showing any symptoms.
No.
Is that correct? Or
No,
sick
no,
enough
get
to go to
sick
the
need to be in the
hospital?
hospital.
Okay.
I have 2.
Okay.
One of them has this, what we call it, multi-system inflammatory disease.
Yes, exactly.
Has
The heart issue.
myocarditis, has fever more than 5 days, and present 3 times in emergency room with abdominal pain, possible appendicitis.
Interesting.
Then the 3rd time I said the parent, nice family, I'm going to admit him. Troponin was 2,000. Fraction ejection was 50%.
Right.
We treat him very well. He came back to follow up the other day. He's doing great. Another one, Kawasaki-like syndrome, 5 years, complete Kawasaki-like syndrome, and she did very well. It means in my own practice, I have 82 patients. Only 2 did little bit sick, and these 2, they're doing great right now.
Nice.
It means 100% they did very well.
Right.
And the newborn, I'm not worried about it. My nurse practitioner actually was pregnant. She told me this story. She told me, she came to me one time, she's a beautiful lady. She says, look, Saloom, during COVID, either you gain weight or you gain weight. Me, I did 2 weights.
Gain weight, gain
and I
baby.
get pregnant. And she has the COVID. She was a little bit sick for a few days. The baby beautiful, and she's beautiful. She's doing great.
Nice. You have extra time in your hands. You have a loved one at home. You know, life is good. Dr. Fennelly, I'm going to go to the boosters now, only because I feel like we are all celebrating,
Right.
and we are all getting back to our new normal. And this is something too that we haven't studied yet, but the studies are going on of how long the vaccines that the 3 of us have had now for several months, how long are those going to last us? And again, there are a lot of things that we know. There are still some things we don't quite know.
Right.
When do you see, or your colleagues and what you've been reading and studying, of when we all should receive the next vaccine? Is that a year? Is that 2 years? What's the big discussion
So
around
there
that?
are 2 considerations. One is, if the virus does not change at all, how long does
Which-
immunity
Right.
last against the original strain upon which most of the vaccines have been based? That alone, it could last for a year or more, perhaps. We know also that the mRNA vaccines do an excellent job if you get both doses of giving prolonged immunity. We know also that
So slow down to the mRNA, so that would be the Pfizer and the Moderna?
Pfizer, Moderna.
Okay, so let's talk about that. We'll not talk
Right.
about that. I just want to
Okay.
separate those out for the audience so they know what we're talking about.
If you've had COVID, recovered by COVID, you probably would be protected for the first 5, 6, 7 months, but it would behoove you to be vaccinated because it's been shown that vaccination after infection will boost that protection even more. There's also very encouraging evidence on the Johnson & Johnson or adeno-based vectors that we can get good prolonged immunity. The challenge now is becoming, with some of the variants of interest that become variants of concern,
Right.
will that immunity be effective against those? It's too soon to predict whether it will be and when we will need to be boosted. This circles back to why I think this is one of the most compelling arguments for immunizing everybody. The teenagers, the children, they're not totally without risk. They can develop
Absolutely.
this MSIC. They
Right.
can be hospitalized.
Right.
They can die. And that has to be balanced
And they can
against the risk.
transmit.
And they can
That's
transmit.
the most important thing.
And in certain states, it's been shown that the variants become the predominant strain in that population if unimmunized, and the rates of infection and hospitalization go up 300% in a non-immunized population. We've seen in other populations, counties, rural areas in the U.S. where vaccination rates may not be much above 20-25%, where you're seeing 700% increases in hospitalization, probably due to the variants that are more transmissible and cause more severe disease.
There are so many questions around that I'd like to ask, and I don't even know where to start. So variants are basically a mutation of something within the virus that makes it just a little bit more this or a little bit less that. So when we're looking at, and I remember when months ago, like the India variant, I know that's not what it's called, but I'm going to refer to it as that because that's what everybody's referring it to. So there's a variant there, and it is spreading across the world. The vaccines that we have now, and we're looking at Johnson & Johnson, Pfizer, and Moderna. At this point, it looks like those three vaccines are good for the India variant. Is that correct?
They're good, although there's probably some loss in effectiveness.
Okay.
Is it above 85% still? Perhaps.
And again, for vaccinations, you're looking simply for 50%, and that's FDA approval. If you're looking at 50% approval or a rate of efficacy. I cannot speak. But we got to 95 on these two, so that's already above and beyond.
So, this gets, without getting too much into the weeds on this gets into the question of what do we need for herd immunity. We still don't know that. 70 to 90%, that would mean 70, 90% everybody in El Paso, including 6-month-olds,
right.
or the youngest we can immunize, are fully protected. So the variants introduce some doubt into that. The vaccine may not work in 3 to 5% of people. Some people may not have a second dose. So those are all the unknowns.
Right.
And still, we're not vaccinating anybody below 12, which is about
Exactly.
10 to 15% of the population. So those are the unknowns. So the 50% was sort of just an arbitrary, that was the threshold that the FDA felt. We've done that with the flu vaccine. The average seasonal flu vaccine may only be 40 to 70% effective. So again, we have a home run hit. Fortunately, I think we're going to keep up with it in terms of the science. There are vaccines being developed that are using the surface proteins from the variants.
Okay.
That probably will solve that problem. So we're in good shape in terms of, the disappointment is for the majority of the world where the hope is in the AstraZeneca vaccine. There was another mRNA vaccine under development that would have been stable at higher temperatures, similar technology to Moderna. Unfortunately, it looks like it's less than 50% effective in the early phase 3 trial. This would have been an affordable vaccine. So this is what we're going to be faced with on a global basis in terms of continuing to try to control COVID.
I don't know, and we did not talk about this before the show, so if I'm just throwing this on you, forgive me. But I know that we are at the point also now with our sister city in Juarez and in Mexico in general, of the distribution of vaccines. So there's the two issues there. Number one, the distribution, the receiving them in distribution, and number two, the hesitancy with that population as well. Is there anything that you two know that might be new on any information with the distribution in Mexico? And we can be specific about Juarez, because I know a couple of months ago we were having a hard time just getting vaccines there.
I mean, what I can say is I know of attempts early on to try to say, look, we have some extra Moderna or Pfizer vaccine here. We'd like to distribute it in Juarez. There was no mechanism for that because of the approval process. The best avenue for Mexico is to work through COVAX. So COVAX is beginning to supply vaccine. The U.S. government, I think, has contributed 500,000 doses to Mexico, which is a start. So I think that's going to have to be the pathway for areas like Juarez. As of right now, looking into the future, it would make a lot of sense if we could do this regionally in a binational area across borders, because like everything else, like air quality, water quality, infectious agents, we're essentially one functioning cosmopolitan area. But unfortunately, those have been the barriers.
And is there, and again, I didn't ask before the show, might we know what the vaccination rate in Juarez is right now? I do not know
offhand,
at all.
I do not know.
Okay. I know that was something that we're trying to
I can tell you something happened with us as Pediatric Society and Pediatrician in El Paso. When we have a limited amount of PPE, gloves and masks and shield, and the Juarez was a lot worse, and it was a lot of morbidity and mortality, a lot of people getting sick. We donate, everybody donate maybe tenth what he had, and we give it to Juarez.
Yeah, and so for most of you, you know, I do this as a volunteer, but my real job is the El Paso Community Foundation. And that was one of the first things we're trying to do is to get PPE to areas that weren't hospitals, you know, to clinics, to pay. And it was very, very difficult and then getting them across the border was a whole nother issue.
Correct.
So I wasn't sure where we sat on that. Dr.
Yes.
Fennelly, you were going to add something?
No, I guess, you know, just the situation with the unaccompanied minors, there's
Right.
upwards of 4,000 plus at the Fort shelter. After the vaccine against COVID was approved, there wasn't quite a mechanism to immunize because the assumption is most of those children are supposed to be transited out of there within a certain amount of time, and they wouldn't have that 3-week window. So unfortunately, that was a missed opportunity. So again, there are a lot of missed opportunities in terms of populations and congregate settings in particular.
Right, and then the parent-guardian situation.
Yeah.
Like I said, that's kind of getting
That's a
stuck in the
separate
weeds as well.
discussion, but it's an important discussion. Yeah.
Agreed. So, Dr. Fennelly, we talked a little bit about this on the last show, but with boosters and flu shots going forward, I remember us coming on the air, I want to say it's maybe August, and we were talking about August, September, October, it's time to get your flu shots. That is something not to ignore.
Right.
And so maybe in the future, the flu shot and the COVID shot may be the same, in and of the same. We talked a little bit about that.
I mean, they could be given at the same time. And the big change over the last few weeks has been that the CDC has said that you can co-administer vaccines. So as pediatricians, we need to give several vaccines at once to keep up. In general, we're behind with vaccination. I'm curious to hear how you're doing in your practice, but in New York, June through September of last year, they were 80% off on measles, mumps, rubella vaccination rates compared to the previous year. The good news now is there's no hesitation about giving both the COVID vaccine and other vaccines at the same time. The assumption is they will not interfere with one another. No reason that shouldn't be done with the flu vaccine.
Right.
Again, in time, we look forward to a time where we're getting our seasonal COVID vaccines.
Absolutely. And so talk about your practice a little bit, as
Our practice, we seize any opportunity to catch up with vaccine. Actually,
with all vaccines.
All vaccine.
All
and
vaccines.
Yesterday, some people come for vaccine, and one child needs 4, and the other child needs 6. Then the nurse coming to me, poor child, he needs 6. Can I give him 3? I said, no.
Give them all.
Please.
I commend you.
Yeah, exactly. We don't lose any opportunity, waste any
Right.
opportunity to catch up with vaccine. And I agree, we did not, it was fear, it was uncertainty, people not showing. You think somebody has no complaint, he will not come to physical when the media and El Paso positive rate 40%, nobody will show up.
Right.
Even us, we
Right.
don't show up to our work. For that, we are behind,
Right.
but we don't let any opportunity leave us in labs. We don't. Anybody come, we try to catch up with all the vaccine. And it is very important, actually, opportunity for us when somebody come for COVID vaccine right now to catch up with all the vaccine. And I think all the pediatricians do this right now.
Yes.
Dr. Saloom, I have to say I was one of those people, and I will put my tail between my legs in saying that, but I still need to get my second shingles vaccine. And so in my head, too, I'm thinking, well, don't get any vaccine, because if you're going to get the COVID vaccine, and so again, unfounded, I'm listening to social media, I'm listening to the lady down the street. I still need to get my second shingles vaccine, and so that should not be an issue. But I'd like to bring that up. So vaccines, which is, what else would be out there that's pretty common? So shingles vaccine, which is several years ago, the HPV vaccine, that should not be an issue. So
now,
are there any?
Right now, college.
Oh, meningitis.
Meningitis vaccine.
Yeah.
Right.
And we're trying to call them, come here before you go to college, otherwise, to find a home for you is difficult.
Right.
You come to us, we give it to you, provide it to you. And a lot of them coming right now for the meningitis vaccine because of the dorm and the college, and they're showing up.
So making that very clear,
Yes.
that it is fine to get other vaccines associated.
It absolutely is,
Okay.
and it's essential. I mean, if we drop below a certain threshold with measles vaccination, we drop below that 93% herd immunity among children, 90%, then we're going to begin to see outbreaks.
Gotcha. Sorry, I'm reading a question here from the audience. I'm just going to read this cold. Hypothetically, if we were to pay for the COVID vaccine, how much would it cost for one person to get the vaccine? Sorry. The good thing is, I don't know if you all know, the good thing is it's free.
It's free, and the actual cost has been of what it's been offered to the U.S. government, we know for, I think, Moderna, Pfizer, is somewhere in the range of $19 to $25.
Okay.
Yeah.
And this is something too, I don't know if we talked about it in the last program, but when I got my vaccine in general, they will ask for the insurance information. And I think a lot of that is too to register you and make sure that you are in the system. The insurance company knows that you have been given this vaccine. Is that the reason why? Because it is free anyway, and if you are covered by insurance or not, the information is still something that you write down before you get the vaccine.
The insurance company pay administration fee.
I see. Okay.
Yeah.
Yeah, because you are using your time, you are using injection, you are using alcohol, you are using documentation. Maybe this is the reason.
Okay.
Yeah, and I want to tell this audience that they are lucky. In some certain part of world, a black market can arrive.
Oh.
Yeah.
Yes, it will be cost
You know what? Do talk about that.
$200 to get
Right.
a vaccine,
Yeah.
or maybe more.
And may not even be
This is correct. Maybe it's not stored appropriately.
right.
Maybe not transported appropriately. Maybe it's not given appropriately, and you don't know what you're getting. They don't disclose what vaccine. Is this Russian vaccine, Chinese vaccine,
Right.
AstraZeneca? They don't disclose to you.
Yeah.
Yeah, for that, we are lucky here, very lucky.
Are we having any of that issue in Mexico right now?
I don't know.
I know. Look at that. Just that's this is going to begin the show. And maybe to anyone who is listening, and I'm going to repeat this. Actually, I should have done it several times before the program was over. I don't know why my flashlight's on, but vaccines, again, free for children ages 12 to 17. You can go to the Civic Center. Just drive through. You don't have to have an appointment. Just drive through Civic Center, 8 a.m. to 7 p.m. Monday through Friday. Ages 12 to 17, you will need a parent with you or a legal guardian with you. But again, it's free. Just hop in the car and go over there. Get all the kids from the neighborhood. Round them all up. 8 a.m. to 4 p.m. on Saturdays. And again, with parent or guardian, you can also get them, if you can, the best place really would be at your primary physician. If you've got a pediatrician, go there, call them first to see if they've got the vaccines. But as you said, Dr. Saloom, that things are coming faster and faster that way. Yes.
Can I mention something
Please.
different? Please. Right now, it's closed, school is over.
Yes.
And a lot of traveling, and some people right now international traveling.
Oh,
Yes.
that was one of
Yeah.
my questions, yes.
Yeah, I want to tell the people to have this evidence of vaccine with them, number one. Number two, if they need a test before deporting in the plane, is required, has to be PCR test, because in our offices, we have rapid antigen test.
Okay, say that again. PCR test, what does that stand for?
A poly-chain reactive test.
A chain react, okay.
Poly, yeah. For that, this required within, I think, 72 hours.
Okay,
For that, they have to be aware that before they leave town to the airport, to have in their pocket that evidence of vaccination, which let's call it COVID passport.
right.
And to have the PCR there done within 72 hours, and this required insurance and
Okay,
payment.
I
because
see.
done in
I see.
private-
That's where you're
in
going.
private
Okay.
lab.
So the rapid test,
The antigen one is not acceptable by airplane.
okay.
Yes.
Is it because it is less
Less
accurate
it is
on?
less sensitive. It's
Okay,
positive.
okay.
The positivity is very good, but the sensitivity is not so good.
Okay,
It means maybe you have, if it's positive, you have the disease. If negative, doesn't mean you don't have the disease.
so I'm going back home to Germany in
Yeah,
September.
yeah.
So I'm already in my head thinking, okay, we
You
have
may
to take a
do
test
so.
before I go.
Yeah.
I got to take tests when I get there. And at this point, and there are certain countries still are a quarantine
That's correct.
situation. This went fast, so we are about 5 minutes before the show ends. Dr. Fennelly, I would love for you to think about if we haven't talked about something you want to talk about yet, or if you want to stress something more, and I'm going to have the same question for you in a moment too. What have we not covered yet that we'd like to cover? And that was great that you brought up international travel.
I mean, I think it's been comprehensive as of now. I think I view this challenge of getting more people vaccinated not so much as hesitancy, but there are a lot of questions. We have a lot of questions. On the other hand, I think everything's pointing in the direction of continued effectiveness of these vaccines and safety. And I can't stress how important it is to stick with facts. If you are promoting false information to your friends in your social circle, you're potentially doing tremendous harm. You could save a life by reassuring by encouraging people to stick with the evidence and to get vaccinated.
And again, to find out the evidence, where are you sending people as a doctor?
Yeah, I think, again, the most authoritative, if somebody wants to read it with their own eyes, would be the CDC website. It's updated daily. There's fantastic links through there. So that's probably the most comprehensive, most accessible.
And El Paso Strong is still, if you want to look up El Paso Strong, the search engine, that's still giving that information. That's local and national as well. Dr. Saloom, what have we not covered yet that you'd like to talk about?
Yes, I think we were comprehensive, I agree. I want to remind the patient and the family, please go to your PCP. Your PCP, you know him for a long time, or her.
Your general practice,
Right. You trust them, and your PCP do something else. Me, I don't feel embarrassed calling for help. I call infectious disease guys, I call some people out of town, what we do right now, what advice. And since they trust you, and you can really relay this message to them. If you tell them go read CDC and FDA, they get lost. For that, go to your PCP. This is what my advice. And your PCP, since him and his children and his wife get the vaccine, he's not going to harm you. Just go to your PCP.
Exactly. And if for some reason you don't have your own doctor, we do have clinics here in El Paso.
Yes.
They're everywhere. Texas Tech has clinics. And again, good old-fashioned Walgreens, good old-fashioned CVS. And again, I'm going to bring up the Civic Center one more time, and I feel like there's another place too, but again, elpasostrong.com or elpasostrong.org, pardon me, will give some information as well. But 12 to 17-year-olds, that's what we're trying to really get down right now. The majority of people who are 18 and plus in El Paso who want to get a vaccine have been vaccinated, at least one shot in and then the other one to come. But 8 a.m. to 7 p.m. Monday through Friday would be at the Civic Center for children that are 12 to 17. And then on Saturdays, 8 a.m. to 4 p.m. And again, that's at the Civic Center. Super easy. You just go in, you drive up. They may or may not ask you for insurance. If you got insurance, you can have it. It doesn't mean you have to have insurance. That has nothing to do with it. It's free, completely free, parent or guardian with you. If you want to watch this program again, if sometimes we just go a little bit too fast, which I know we do, there are several ways you can do that. And we're streaming live on YouTube. I forgot to say that earlier. But if you are somewhere else, or if you have to leave the television or your phone, you can use youtube.com and then type in the El Paso Physician. If you're looking specifically for this show is called Variants of COVID Vaccine and New Vaccines as well. And again, the variants is something that we've been talking about quite a bit. And I feel like we can do a show just on that, but not including the vaccines. How many variants are out there, más o menos, right now?
Well, hypothetically, there are thousands.
Yes, please, yes.
Just I want to mention one more thing for the breastfeeding is safe. If you have a baby, you're breastfeeding, please continue breastfeeding. We recommend the breastfeeding. Continue with your breastfeeding.
Okay, even if you have COVID, breastfeeding is safe.
Please continue.
And that's again where biology is beautiful because it doesn't let things pass that line.
Just wash your hand well, put a mask, and feed your baby.
Okay, excellent. Again, pbselpaso.org is where you can watch us again and all the other episodes, and then the El Paso County Medical Society, epcms.com. I want to say thank you again to Madeline Morris, who has been dealing with all of our questions. I want to say hello specifically to Mario Ramirez, who has been helping us out for many, many years here at PBS El Paso, and he is moving on, but still going to be here to help us out. So I wanted to say a nod to you, Mario. I know that you're in the back, so this is specifically for you. And we have Brenda here counting us down. We've got Gracie in the back doing things, and Frank Luna, and every now and again they get some credit. I'm Catherine Berg, and you've been watching the El Paso Physician.
Thank you very much.